Robbins.
Good afternoon. Dr. Robbins, practicing in Exton, Pennsylvania for about 35 years. Graduated from the University of Pennsylvania, taught there for a while, and opened up a private practice in Exton, Pennsylvania. I saw some contradictory information. I started off putting mercury fillings in, taking them out like everybody else, and in 1981, after all the contradictory information, I decided, this is crazy. Nobody knows what to do with the excess amalgam. Nobody knows what to do with the excess mercury. Put it under fixer, put it under water. We didn't know what to do, so I stopped doing mercury fillings. In 2001, I began to wonder what this effect of mercury is having on my patient's health, and I started a study in my office of all new patients coming in. I bought a mercury vapor atomic absorption spectrometer for my office, demographic data. You have the handouts from the study. Methods, we measured the room mercury vapor, we measured inside the mouth immediately, had them chew gum for 3 minutes, measured again. Got patient consent. This is what we do, it only takes a couple of minutes to measure. The residential level of inhalation mercury, the AT, SDR, the EPA, they say 0.3, you've heard this before. Well, what do these standards mean? What do these levels mean? Are we going to stick to them, or are we going to make up our own levels just to appease various associations and health risks to the public? The industrial level is a little higher, but when you work, you go out of the room, you go in the room, there's ventilation. You don't have that when it's coming out of your teeth. This is 876 patients from 2004 to 2009. The blue line represents the number of fillings when they first sat in the chair, from 0 to 40 surfaces of fillings. The vertical line is the mercury level, micrograms per cubic meter, and you can see after they chew, the mercury level goes up. But look at the level on the left. It's 0, and then it's 50. If we look at the 300 nanograms that we have as our standard, it's almost at the x-axis. Everybody above it is above, in my practice, that I measured, is above those levels of toxicity, inhalation toxicity. And if we look at a population of 25 to 35-year-old females or childbearing years, it's even worse. They go up even higher. If you want to use industrial levels, you're at 10, and even that, most of the people are above that level. This is what I really want to present. It hasn't been presented before. Most of my patients come back, measure them every 6 months. And here's a patient that's typical. They came in June of 2005, 12 fillings, very high level, 60. They came in December of 2005, they had less fillings, 4 fillings, the levels went down. And the last 2 checkups, the levels are 0. That means you take the mercury out, the level oral mercury vapor inhalation in their body goes down to 0. It may not get them healthy, there may be permanent damage, but the future exposure to mercury is down to 0 once you get these fillings out. And in conclusion, mercury vapor is continuously released from mercury fillings. There's no doubt about it. And what's the level? Are we going to go with regulatory guidelines? Are we going to make up some imaginary number? Because everybody in my practice just about who has 1 or 2 more fillings is higher than the levels that we have set already. Alternative materials since 1981 I'm using, they last 10, 20 years just like mercury fillings. And very important, if we're going to remove toxic mercury amalgam, it doesn't just end there. You've got to take it out safely, and if you don't do precautions, we get more exposure to patients, and we get sicker patients.
Doctor, you need to wrap it up.
That's it, thank you.
Thank you. Thank you for that great presentation.
That means you take the mercury out, the level oral mercury vapor inhalation in their body goes down to 0. It may not get them healthy, there may be permanent damage, but the future exposure to mercury is down to 0 once you get these fillings out.